If that's the case, then if I don't eat fat, I'll lose weight. I say wrong. Because vitamin A, D, E, K is oil soluble. Your cell membrane is made of oil. You cannot don't eat oil. What you don't want to do, you don't want to eat a lot of oil, oily, your prawn swimming in oil, breaststroke, your chicken backstroke, your fish front crawl, butterfly inside oil, So when you eat more, it stores more lah. So the concept is eat some oil, but please do not overload on the oil at one go because it's very high energy. It will store as fat. And if you store until no place to store, it will go inside what? Your organ. And that's where things start to go wrong. Okay, start to go wrong. Okay. So when you eat whole foods, you tend not to store. When you eat processed food, you tend to store. So you ask yourself and you look at your friends around, are processed food more common or whole food more common? I think you know the answer. There's no need for me to answer. All right. So here's what happens. Now there are two types. There are few types of diabetes. Type 1 diabetes is when you have blood sugar in your bloodstream, but your pancreas cannot produce enough insulin. So there's a lot of blood sugar left inside. Not enough soldier to put it into your muscle. It's called type 1. Usually it's an autoimmune disease, and it usually happens during childhood times. Okay, and there's type 2 diabetes. Type 2 diabetes is when, of course, you're producing blood glucose and your pancreas is producing enough insulin, but because of your abuse of insulin and blood glucose, it becomes numb. It's called insulin resistant. The insulin failed to put the sugar into the muscle. So that's called type 2 diabetes. Usually adulthood, because you abuse your body. Okay, by putting on don't know what kind of food inside your body. Then there is type 3 diabetes. Type 3 diabetes is called Alzheimer's disease. Okay, your brain gets damaged because of diabetes. So ladies and gentlemen, today Alzheimer's disease is also known as type 3 diabetes, but research is going on. But researchers are already publishing papers in health journals, medical journals, to call it type 3 diabetes because they found a huge correlation of dementia and diabetes. All right, so this is something you need to know. Now, complication of diabetes. You can get a stroke from diabetes. Kidney. By the way, 60-70% of kidney dialysis patients are diabetic. Okay, of course, your foot, you get a cut, it doesn't heal. What else? All right, you get blindness. Yes, serious diabetics do go blind. Heart attack. The risk of getting a cardiovascular disease or heart attack when you're diabetic is much higher than somebody who's not diabetic but have high cholesterol. If you're diabetic, you have low cholesterol, your chances of getting heart attack is higher, okay, than somebody who's not diabetic and high cholesterol, by the way. Okay, and of course, we have nerve tingling in the finger and all this. All these are nerve damage. In short, some people say, how in the world does blood sugar connect to all this? I thought heart attack is cholesterol, stroke is cholesterol, but why is it diabetic? Well, high blood sugar damage blood vessel and it leads to all this. Period. A very simple way to say it, high blood sugar damage the blood vessel. When you damage blood vessel, cholesterol will stick. If you don't damage the blood vessel, cholesterol will not stick. Why go and tickle your cholesterol? Okay? Now, what does the authorities worldwide say? The American Diabetic Association, is very straightforward. Type 2 diabetes is a progressive disease, period. It keeps getting worse. They say nothing else. John Hopkins says that people with diabetes cannot maintain healthy levels of blood glucose unless they carefully monitor their food intake and in most cases, medication. John Hopkins has a better solution. Do both. Okay, food intake and take your medication at the same time. Now, what does the Singapore Ministry of Health say? You can reverse pre-diabetes and prevent type 2 diabetes with healthier lifestyle choices and habits. This is from the Ministry of Health from Singapore. And they still stick to pre-diabetes. They don't want to talk about diabetic patients, right? Now, what does Ministry of Health of Malaysia says? While not a cure in traditional sense, achieving remission where blood sugar levels return to non-diabetic ranges without medication is key focus. So Ministry of Health of Malaysia has gone one step further and says you can achieve remission without stating whether it's pre-diabetic or diabetic. Okay, so these are from the government. Okay, they sometimes, if you look from the American Diabetic Association to the Malaysian Ministry of Health, you notice it's quite far apart of the way they comment. So who is right, who is wrong? End of the day, the conclusion is this: we can get type 2 diabetes into remission. Okay, we must not ever use the word cure, because there's always blood sugar inside your bloodstream, and if you abuse your body, it will come back. So there's no such thing as cure. The cure is not a correct definition. It's called remission. Okay, you reverse it back, and if you abuse it, you will come back again, because it's a normal body function, right? So what is the main cause of diabetes? It's actually the most common source of diabetes is actually insulin resistance. And here's something important. What are the two causes of insulin resistance? Number one, too much insulin in your bloodstream for too long. That's the number one cause of insulin resistance. Number two, intramyocellular lipid. There is fat inside your cells, your muscle cells. That's what causes insulin resistance. Let me explain to you one at a time. Okay? Now, let's talk about too much insulin for too long. What does that mean? You know, some people, you go out with your girlfriend, you go out, wow, your girlfriend smells very good, go put perfume. Then after you hug her for a while, after 1 hour, 2 hours, you don't smell the perfume anymore. The nose go numb. Okay, or you spray your own perfume. You can smell it when you spray. After that, you don't smell it anymore. Somebody else can smell it. Okay, the body has this numbness effect. Okay, or how many of you who has done karate or taekwondo before? You keep punching. After a while, your knuckles doesn't hurt anymore. You will hurt other people, but it doesn't hurt your knuckle. The skin go numb. Okay, it thickens to go numb. Insulin resistance is the same. Okay, it's caused by abuse. If you constantly abuse your body with high insulin food, okay, very high glycemic index, extremely high sugar, everything here you see is sugar, although it's carbohydrate, it's actually sugar, and you rush it in for many hours a day, and you don't even know. I know some diabetics who tell me I'm diabetic, but when I check, they're still eating bread. Sugar inside there, they'll start storing as fat. And if you store as fat not fast enough, you will have blood sugar floating inside. And this blood sugar will damage your blood vessel in time to come. Okay? Even if you have very little cholesterol, it will also stick, because cholesterol job is to stick at the part where it's damaged to try and repair it. And if you damage it and abrade it 24 hours a day, you know what you're going to get. Okay? So this is abuse. All right? Now we talk about intramyocellular lipid. This is something that people don't really know. Okay, your muscle is supposed to look like that. Okay, but if you pui, I mean you eat until you put on weight, you become wagyu. You know wagyu beef? Your muscle become fat, begin to go inside the muscle, and then finally it lands inside your muscle cell called intramyocellular fat. Then that becomes a problem. Now, these fat are stored around inside the muscle and inside your cell originally so that your muscle can draw it as energy when you're starving. But the trouble is we have never starved today. So it keeps storing, and when there's too much, you get insulin resistant. How does that work? Okay, by the way, if this is your cell, that's a fat inside your cell after a while. Okay, this is how it happens. Imagine these white crystals here is your sugar that you consume, or carbohydrate or whatever. This represents insulin. This is the insulin receptor. This is a cell membrane. This is the inside of a cell. That's the outside of a cell. And these are fat. You're supposed to have a little bit of fat inside there. Your insulin come in as a key, unlock this. Your receptor opens. Your sugar goes inside a cell, and you can use it for energy. That's what a normal cell is supposed to do. But what happens is when you have so much fat inside your body, it sticks all over the place. Your insulin go around there and unlock. No response. After no response, cannot go in. Then the sugar begin to and to fatten skinny kids. Okay, that was the use in 1923. Of course, today it has progressed to become a weight loss product. Very scary. Okay, and everybody is on a diabetic pill. Suka, they just give. Okay, you see this? This is called this is where the insulin, you put a lot of insulin jabs there, fat accumulate there. So insulin do cause fat to accumulate there. Okay, this is called an insulin belly. All right, so the good news is you can live normally with type 1 diabetes. And these are the famous people with type 1 diabetes, and you can still look muscular and handsome. You can still sing. Okay, you can still act, you can still swim. Okay, they are type 1 diabetes. So that's a good news. Okay, you can live life normally if you take care of it properly. Let me ask you this. Julian He, body like that, type 1 diabetes, do you think he just rely on insulin to look like that? Or did he also do proper exercise and proper dieting? Okay, you decide. Okay, don't you ever believe just putting insulin jab your body become like that. It does not. Okay, so the best long-term way to hold blood sugar down is what? Change your eating habits and lifestyle, get rid of the VFA, which is the organ fat. Okay, this is organ fat. It pushes up. This one drives your insulin nuts. It is connected to 13 cancers and over 300 diseases. Okay, but it's easier said than done. Lose weight lah, so easy. So many people, the doctor already advised them to lose weight, but they never lost weight. Never did. Okay, so method one is to give the person a drug, pull out the blood sugar. That's it. And the blood sugar either sometimes gets stored as fat. Actually, very often. Method two is to stop the sugar from going in. Okay. So method one is like me tying shoelace for my kid. My kid will always be dependent on me. Okay. Method two is teach the person to tie their own shoelace. They will become independent. But guess what? Most people prefer method one. That's just there are so many people on drugs, okay, and not reversing at all. Okay. Now let's take a look at some people who manage to combine medical drugs with nutritional program. Medical drugs with nutritional program. We have people like this lady. She don't want me to reveal her name. This is HbA1c 9.4. Doctor gave her a drug, dropped to 7.7. The doctor said lose some weight. She was introduced to us. I brought it down to 5.7. Okay, in combination with the drugs. The doctor did say that if you don't change the way you eat and you don't lose some weight, my drugs can only do that much. Okay, so the doctor is very practical. Okay, this is ginseng. He allowed us to use. He lost 29, almost 30 kilos. It took us 6 months to do that. And as you can see, his blood sugar nosedive started at this, went to this. His HbA1c from 7.5 to 5.1. Even his triglyceride and his cholesterol, his good cholesterol went up. His triglyceride came down. And this was a letter written by his doctor that he has worked hard in our coaching program, and it's now BP is normalized, blood sugar is normalized. They took out his drugs. Okay, so do you think it's reversible? The very moment the person loses the stomach, do you think it's reversible? And now I have a very special guest. Her name is Pauline. She has agreed to come in. She's very busy today. Actually, she cannot make it, but I asked her, can you share to help people? She immediately rescheduled her appointment, says, I'm on. Okay, so can I invite Pauline to share with you? She's also a diabetic patient and share with you her experience. Pauline?
Yep, I'm on.
Okay, go ahead.
Okay, I come on to, I'm Pauline. I'm 64, coming to 65. 3 very active grandchildren. And I think Olivia has seen me running after them. Okay, I joined the PGU program because of my diabetic issue. Okay, my HbA1c is always very high. It's 10, sometimes it's 9.5 and all these things. So I decided to try out lah, because if you don't try, you won't know, right? It took me a long time to consider. And being on insulin jab is not an easy feat lah, because it could be painful, and to a time that sometimes you resent it. Okay, but coming on to back to PGU, with the proper coaching, I managed to reverse it. Okay, and I really want to thank my coaches and this PGU program, because it's not like something you cannot achieve. It's basically a change of your lifestyle. Take your right supplement, and the supplement is so easy. It's all prepared for you, and it's not like you have to bring the whole chunk out, right? Okay. Then there's this, of course, I have to put in the little effort of exercising lah, which that one I really have not been doing very well. Okay, I mean really not been doing very well, other than running after my 3 grandchildren. Because the hobbies that I like are all very sedentary: knitting, crochet, you know, cross stitches. So it's basically all sitting down. But I make the effort lah to walk, and now I could climb the stairs, and that's how PGU has helped me. Okay, I can run after the bus, and I think Olivia teased me and said I can run after a Ferrari. Yeah, the stationary one, I could do that lah.
Are you still diabetic medically right now?
Medically it's still considered, because I'm still on metformin. The doctor has not removed that, and I'm hoping lah that by the next appointment there will be a better answer for me lah, that maybe can reduce the dosage, or best take out all lah. But I tell you, this doctor is very good. He is very encouraging, and he tells me that he can only treat symptoms. He cannot help me cure it. Okay, a lot of things depended on myself, and I'm very grateful lah to this PGU program for helping me control things that are within my reach. It's not something that is out of your reach, you know, that you cannot reach and you just want to get it. No. After going through that 90 days, I tell you, it's so different. I can say that I'm full of energy. My knees doesn't hurt as much. I am not so, what do you call that? I don't feel so down now lah. I feel that I'm very lifted up, although I'm still very round.
So you are, the doctor took out 75% of your medication, as I understand
Yes.
from you, including the insulin jab.
That's right. Now I'm not on insulin jab. I'm only on oral.
Ah, okay.
Yeah.
So the doctor
that's actually a very great improvement. It's very great improvement for me.
after 24 years.
Yeah, after 24 years of diabetic, taking medicine and all this, no, it's the jab that is bothering me. You know, to the extent that actually, okay, when I came onto the PGU, what causes me to start coming here is one thing, is I could feel the pain already when I do my jab. You know, previously it's just a jab law. You know, no choice lah. Like they say, diabetes is progressive, right? So you just have to take it as it comes. But after going through PGU, I said, oh, that's not true. So now I'm very happy, and I really hope that my friends out there who have this issue of diabetes to try it. The gain is much more than what you have to invest in. Seriously. If you don't try, you won't know. So go ahead and try. And I really wanted one of my friends to come in, although I know it's very hard for her to come in, but trying to ask and crack her.
Okay, thank you very much, Pauline. That was excellent sharing.
Thank you for having me.
Yeah, Pauline has always wanted to say, if you can save that one person,
Yes.
she will share.
Yes.
Okay, she's not afraid to show her picture. She's not afraid. We should have taken bikini picture of you, so you
No
dare
lah.
to share.
My tummy is still, like I told Olivia, my tummy is still big, and he told me, yes, because of so many years of insulin jab. So now,
give it time,
mind,
you'll
I
come
will
down.
try. It will go down.
Okay, thank you very much, Pauline.
Yep.
All right, so let's compare fat loss. Let's talk about the methods she used, right? So the first method is called calorie in, calorie out. The carbs you go in, the carbs, protein, and fat you go in, you got to take it out. So you take out more calories, you put in less, you lose weight. You put in more calories, you take out less, you gain weight. That's a concept for 200 years, but why is the world getting fatter? Because of 3 misunderstandings. 1, when you digest food, you actually use up calories, and it's 10%. When people try to go on weight loss, they stop eating altogether, and that's not a good thing. And most people go and exercise, but you can exercise a whole day, you only take out 20% of a daily calorie. But So exercise is very tough. I agree with exercise. I encourage exercise, but it's tough. But there it is, 70%. Why don't we leverage on BMR, which can take out 70% of the calorie? In short, we actually teach you how to sleep your fat away. Even like Pauline says, I don't really exercise a lot, which encourage her to do it, but she still managed to lose the weight. Okay, she still managed to lose weight. The blood sugar just, went into remission for some kind of reason. Not totally, but almost there. So that's basically what we teach people to do. And because of this misunderstanding, Slimming Center will give you slimming tea lah. They will wrap you. You want to wrap, you come to my kitchen, I wrap for you. Don't need $10,000. I use my cling wrap, I wrap for you. Water will come out. Why you pay so much money to a Slimming Center? Exercise, agree, but not everybody can sustain on a consistent basis. You take some food and then you go and poop. Okay, I call this full of shit. Okay, actually water comes out. Or steam you, barbecue you, apple, and all these diets all causes yo-yo. It's not sustainable. Okay? Some people go and read books, keto lah, intermittent lah, Mediterranean. It's not that I disagree that this method doesn't work. It is very unlikely you can sustain. Okay, just like let's say Mediterranean diet law, you Mediterranean for 3 months, you go to special restaurant, you cook your own. After 3 months, you go hawker center, find me Mediterranean food law. By the way, char kway teow and olo is not Mediterranean food, huh? Okay, it's very difficult to sustain. I go Malaysia, I can only find the black kway teow. I cannot find Mediterranean black kway teow. It doesn't exist. Okay, it's very difficult to sustain something that people enforce upon us where our surrounding is totally different. Okay, so rebound is almost a certainty. So this doesn't work. But what works is called insulin management. When you eat something, your blood sugar goes up, your insulin comes in, bring it down. Blood sugar crashes, you go hungry, you eat again. Do you know that when your insulin take the blood sugar out from your bloodstream, 10-15% they store as into your muscle for energy. The other 80-85% they store as fat. So this is a fat storage mode. When you're hungry, you lose your muscle tone, and your muscle tone is the only thing that absorbs blood sugar, and you go and lose it. Imagine this is one meal, you do this 3 times a day, over 1,000 times a year. As you get older, you always get bigger or smaller. Without a doubt, you will get bigger. Okay, and that's what we are dealing with. And insulin management is a more powerful technique than calorie management, although calorie management is also important. Okay? So what most people do is starve themselves to death. Muscle comes down, fat also comes down. Okay? Everything comes down. Then when you eat again, you will explode back. Why? Because there's not enough muscle to use up the calories that you're going to put it in. Okay? So what we do is we starve the fat and we feed your muscle. Eventually, the muscle will take over the program. And that's how I sustain for so long and so many people. Okay? So even if you're not diabetic, you can be healthy couples like this, exercise a lot. Husband and wife came to do it. This, by the way, this waistline and this waistline use the exact same exercise. Exact same exercise, but he couldn't seem to bring the weight down. I brought it down for them, couple. We have people who are Slimming Center herself. She used to work in a Slimming Center. This picture was taken when she was 58, when she is 58. Okay, look at those abs. Her son is 24 years old. There are people who come just to, want to look good, and along the way become healthier, right? And we have people like Grace, who has PCOS, high cholesterol, very difficult to bring down the weight, and the doctor told her the only way out is to lose weight, and it's going to be a challenge because you have PCOS, polycystic ovarian syndrome. All right, we brought down 8 kilos. Okay, so I myself was overweight before. As you can see, this is called in Malaysia they call it roti canai face. In Singapore it's roti prata face. A Chinese cannot put on weight because our face is flat. When we put on weight, it becomes roti prata. Our Indian friends, they put on weight, the face is very sharp, right? Chinese cannot. When you hit the wall with your face, the forehead hit first, you then hit the nose. Okay, so I had borderline high blood pressure and bad snoring. And today, after 18 years, I'm lighter than what you've seen before. So the maintenance is very long. My children's all grown up. Okay, a father. My job is not just to make sure they have education, they have values, they grow up well. My job is to teach them the right health management method, because I will get them in trouble if I teach them the wrong things. So Weight management, number one, we deal with calorie management, but this is 50% not accurate. Number two, we deal with insulin management. Okay, why is insulin management? One apple is 100 calorie, one Coke is also 100 calorie. Are they the same? Ladies and gentlemen, these two are different. But the calorie management, people think they are the same. That's why they just cut your food. It doesn't work. Okay, you got to, so it's 50% not accurate here. So we got to involve insulin management in the whole thing. And of course, the only reason why your weight cannot go down because you have a metabolic health issue, the chemical reaction in your body has gone off. So the first step we do is we adjust your metabolic health. In the first 2 weeks, you will feel the first effect of after lunch, you feel energetic. Like what Pauline says, she's running after 3 kids. These 3 kids climb up and down. She called them monkeys. So you got to have energy, to deal with them, Okay, so that's the first thing we deal with it. Then the second thing we do is we manage your insulin. Once we manage your insulin, your tummy will come down first. Then we start managing your calories. That's when your weight comes down. In Mandarin, they say 斩草要除根. You want to solve the problem, you need it by the butt. You got to start with metabolic health and you go upwards. If you just focus on cutting food alone, it will rebound back because we are covered, we are surrounded by very good food. Okay, so what is this program about? First of all, there's a program that runs on 90 days with a set of products. Okay, the TRME as well as Reset. One to two coaches will be accompanying you, okay, to teach you eating plan and strategy. Then people are asking, isn't eating plan the same as strategy? I say different because we're going to assume that you're going to have welcoming party, farewell party, birthday, 2 weeks of birthday makan, okay, and then bacang, mooncake, Hari Raya, Christmas, Chinese New Year. Then after that, in between, nothing to do, go for cruise. Even Chinese or funeral also got curry chicken to eat. Okay, we find excuses to eat in every occasion because we acknowledge that we all have social lives. So instead of avoiding your social activity just to lose weight, we encourage you to go for a social activity, but we teach you how to handle it. You can go for cruise, come back and lose weight. Trust me. Okay, and of course your BMR eventually will take over. So your coach offer to coach you over Zoom, and if you can meet face to face, if you're in a small country like Singapore, you can do that. If you're in a bigger country, then you do Zoom, which is equally good because we did it during COVID. And of course, if your coaches are available, you can meet up with them. We can go for supermarket walk. We can scan you. We can coach you face to face also. So it's up to the method of the country depending on the geography. All right. So what is in the supplements itself? I would like to share with you. We have 2 weeks of a drink called Jumpstart. It's a super burner. It helps you a good head start to burn your fat very quickly in the first 2 weeks. Only 2 weeks after that is no more. And then there's a drink to help you supplement your muscle growth, to help your muscle grow. And then we have another drink that tastes like herbal tea. It blocks starch, sugar, and carbs, which you cannot stop eating, I'm pretty sure. And every morning, there's only one tiny capsule of control for you to manage blood sugar and your mood. That's it, only one capsule in the morning, that's it the whole day. And 2 capsules of this complex is to increase your metabolism and to hold on to your muscle. Okay, and of course, we have something called Reset to make sure that your intestine is at the best of health. By the way, a lot of people cannot lose it because their intestinal health is not in order. We have to repair the intestine. And there's a bacteria in your intestine that not only cause water retention, it also cause your insulin to rise, high blood sugar and inflammation. So we need to deal with your intestine. That's for the long-term sustainability. All right. So before I end this, I will say this: on the 2nd of July, those people who have decided to go on the program, I'll be conducting the orientation personally. If you decide to sign up the program, I have stopped conducting this program for a very long time, but I will conduct on the 2nd of July from 9 to 10 p.m. We will teach you exactly what to do with it once you have received your product. And then after that, I'll hand it over to your coaches who are all very well trained. They are all at trainers level already. All right. Now, on top of that, there's one last thing I'd like to share with you. Remember 77 million diabetics in India? I got news for you. We are opening in India in November 2025. We will be launching the weight management system first. The weight management currently is worth 800 million US dollars a year in India. And this is only the current year. The growth is expected to multiply. Okay, so we are going to open in India. We have already opened in China. Now open in India, first entry opportunity. Those people who are keen, whether you want to go on the weight management to reduce the fat inside your body and increase your muscle, see you on the 2nd of July. And those people who want